watching Simone at the 2021 Olympics in Japan, you really get a sense for how our bodies are built to move. And I'm going to be talking about bones, but you know, just talking about bones by themselves doesn't work without talking about muscles, because most everything about bones, except for inside the bones, is designed for movement. Okay, she's incredible. All right, so let's get into this. Body movements, muscles contract from sides on bones. So our bones, you may not think about this, but there's warty-shaped bones called tubercles. There are rough surfaces called tuberosities. There are extensions, I mean, think of your elbow, that are called processes. And even fossa are flat surfaces. All of these surface structures and shapes are for muscle attachment, right? And when we attach a muscle to a bone, we go from a muscle to a tendon to a bone. Okay, that's a tendon. Ligaments are bone to bone, such as a collateral. Let's look at this knee for a minute, because I really like the knee. It has a lot of lessons for us here. Collateral means it's on the side, and there's a fibular collateral on the fibula side, and a tibial collateral. We can't see it here. There's a tibia or shin bone. There's the femur. There's a kneecap or patella. And so you can see how these tendons and ligaments keep this hinge joint working properly. Let's start with the skull. It's not so much about movement, but there's a lot of muscles engaged to the structures of the skull. All right, so bones of the skull, they're for promoting facial expressions, all right? We don't think about it, but historically, the expressions we made, smiling, frowning, grimacing, whatever, they may have meant life or death, because it's a communication. And it's still that way today. Okay, eating, chewing, protection, childbirth. Okay, I'll get to all of these. Zygomatic is the cheekbone, and there's really two parts to the cheekbone. In the zygomaticus, which we can see, there's a minor, which is small, and a major, which is larger. But look where they are, okay? They attach at the cheekbone or zygomatic arch, and they go down to the orbiculus oris, the muscles of the mouth. And when that contracts, you're going to smile. So you have two specialized muscles on each side just for smiling. Okay, that's how important smiling is. Yeah. Again, think of our ancestors long ago. Okay, smiling might have meant the difference between getting an arrow in your chest or surviving. Okay, masseter. Masseter is a huge muscle. So we're going to go from this zygomatic cheekbone here to the angle of the mandible here. And it's powerful muscles. Oh, yeah, here we have it. Masseter right there. All right, the frontal bone, which is a good name. And it's thickened right here at the glabella. And what we have is an apron of tissue that's going to go from the frontal through this aponeurosis, a cartilage, all the way to the occipital, the back of the skull. All right. And sometimes you can see young kids, they can move their scalp back and forth just by flexing this muscle. All right. The occipital bone is in the back, and it's an area for lots of muscle attachments. And I'm going to talk about these, but I'm still on this upper part of the skull, the frontal and the parietal. Okay, the parietal is where, when we were infants, we had these fontanelles. Okay, the fontanelles are spaces, sometimes called soft spots. So we have the frontal here and the occipital fontanelle. And this is about making mom comfortable, because look how big this head is, okay? It's got to fit down through the vagina. And the only way it's going to do that reasonably is if these plates can slide past each other. So when you're an infant, your plates are kind of compressed. You compress. You ever seen a baby that's just born? Sometimes the head shape is kind of strange, and mothers will upset. They'll go, what's wrong with my baby? But the plates, you can see, okay, here's an adult skull. We're looking at the superior view, meaning we're up at the top. There is the coronal suture, where the fontanelles were, but now it's bony. So that's you and me. We have the sagittal right down the middle, separating the two parietal bones. And in the back, occipital. Yeah, and here's a diagram that shows historically as an infant. There's your soft spots. All right, so it's real practical. That's what I like about anatomy is most of it makes sense. Okay, yes, we have to learn all these words, but we get to use these words over and over again because these Latinized or Greek words have meanings. Okay, so it takes a while. Like learning this vocabulary at first seems like impossible, but it's like learning a language, and then pretty soon you get it. Okay, maxilla. That should be highlighted. This is the upper jaw. That's purple here. And so, of course, you're going to have the alveolar bone with sockets for teeth. And an important muscle in this region is the levator labii superioris. Okay. Oh, that word looks impossible, but it's not, because levator is to lift. Labii means lips. Superioris means above. So it's going to lift the lips into a snarl. Because if we want someone to leave us alone, we don't do this so much, I guess, but we show our teeth. And that avoids a conflict, because instead of saying lots of words, we can just snarl, and they will leave us alone. Okay, you've seen dogs do it, right? It's humans can do it too. Okay, temporal bone, all right, just with the temples. But look what's going on here. Okay, we have this mastoid process. Massive process, which is an extension where we're going to attach the sternocleidomastoid. There's the word. And you might think, what a crazy word. But it's not, okay? Because sternum, that's the chest area, sternum. Cleido refers to clavicle. So it goes by the sternum, the clavicle, and the mastoid. Sternocleidomastoid. Yeah. All right, so powerful muscle is going to turn your head and lift your ribs. So thank goodness we have that. And there's a styloid process there for tongue. Mastoiditis, anytime you see that suffix itis, you think inflammation. Right? Bronchitis, you've seen this kind of suffix before. So if there is a middle ear infection, because here is the auditory canal on the skull, okay, that's where the opening of the ear is. Look how close it is to the mastoid. And this is error-filled space, a lot of it. Yeah, that's why we don't let people punch on the side of the head, because this is kind of a spacious area. So anyway, if fluids with bacteria back up into the mastoid, then we have a little more serious infection. And sometimes this has to be drilled out to allow pressure release. Let's not think about that. That's not very happy. Masseter, I mentioned masseter for chewing, from the zygomatic to the mandible here. But look at this. We have this large cheekbone, but there's two regions. There's the zygomatic process of the temporal bone, and then we have the zygomatic bone up here, and then we even have the maxilla. So lots of sutures, because remember, when we were newly born, all these plates needed to move around. Okay, think of mom. Occipital, I mentioned occipitals in the back, and there's lots of tubercles, tuberosities that I mentioned earlier. These are roughened areas for muscle. So let's look at some of these words. Rectus means straight. Capitis means head. Okay, like decapitate. Okay, not a happy thought, but obliquus, oblique means at an angle. And so these are good words. We have the obliquus capitis, and we have the rectus capitis. Now, these, interesting, these are, and other muscles in this region, are associated with a lot of headaches. All right, tension headaches. So if you can get your fingers in there, sometimes, or some people use a cold towel, because, you think, oh, I want warmth. But okay, inflammation is sometimes why we have pain. Some people will get a cold a gel pack, and they'll put it back here, and these muscles shrink, and they pull away from the nerve. And for some people, the headache will go away. All right. Now, I'm not your doctor, so I'm not telling you to do this, but I just like to tell interesting stories that help us to learn. Okay, external occipital protuberance, another big word, but external, it's on the outside. Occipital, it's on the occipital bone. Protuberance, it's a tubercle, so it's called the wisdom bump back here for muscle attachment, such as the trapezius, a trapezoid-shaped muscle that is going to attach to this area back here. Well, you can see where the trapezius. And it's going to move the scapula or shoulder blade, rotate it, lots of powerful actions. And you can see how important these tuberosities and fossa and tubercles are. Because if you don't have roughened areas, then what's the traps going to hold on to? Yeah? All right. Sphenoid, called the keystone, because it's in contact with nearly every bone in the cranium. All right. There are some sinuses which are formed by this sphenoid, and mucus is produced by these cells in the lining. And sometimes people think mucus is gross, but it's loaded with body defense cells for kills and removes pathogens, okay, things that would harm us. Hypophyseal fossa is where the pituitary, one of the most fragile glands in the body. In the wisdom of our body, one of the most fragile glands is protected by bone in this depression called the fossa. Ethmoid is associated with the nose. All right, so in the roof of the nasal cavity, okay, so this is your nose, is a cribriform plate where nerves, olfactory, where's the word? Olfactory, okay, this means to smell. Loaded with olfactory nerves, so we can smell, and if we want to eat it, you know, we sniff it, and that tells us, hey, it's good. Now, a collision, such as if your nose hits the steering wheel, a lot of people, what happens, okay, they're in an accident and they walk away. I'm fine. But ethmoid orbital fractures, that's the eye and the nose, it's a spongy bone. I think I mentioned it somewhere. Sponge-like. Okay, if it fractures and bacteria get in there, now we have cerebrospinal infection, and sometimes 2 days later. All right, the mandible is the jawbone, okay, technical name for the jawbone. And what I want to focus on is this TMJ, temporal. Yeah, this is going to help us a little bit. The condyles are a rounded area right here on the end of the process. Okay, let's take a look at this, because sometimes seeing a video helps. So what's that muscle? Temporalis. The other one was the masseter. Okay, alignment. Alignment of the teeth, if they're misaligned, sometimes you have problems with TMJ. This is the ideal situation with the pterygoids. Do I have that word here somewhere? Pterygoid. The pterygoid's pulling the jaw forwards. Now, so when we open our jaw, there's a shifting that takes place. There's that shift. And so it's like a dislocation. And here's a picture here. Oh, you can see the masseter right there. So here's the condyle. There's articular disc, and there's articular tubercle and the mandibular fossa. So take a look here. We're going to have the movement, forward movement, but in TMJ what happens is first there's some disc displacement, and there's a clicking sound, and you'll see why. Because, well, not yet. See, that condyle is going to hit the tubercle, and so we get clicking sounds at first. But over time, as arthritis sets in and this region gets thinner, the disc diminishes, and pretty soon we have bone on bone. So the clicking sounds are replaced with pain. So pay attention. If your jaw clicks over and over, have it checked out. Right? Thanks for listening.